Hello, I'm very happy to be here. Greetings to all of you. My name is Lothar Pirc. I'm the founder and CEO of the Maharishi Ayurveda Health Centre in Bad Ems, which I will introduce more now. And like Dr. Girish Momaya, I'm also director of the International Maharishi Ayurveda Foundation. I have started a foundation which is very successful in Nepal, where we are supporting 90 gurukuls, the Foundation for the Promotion of Vedic Culture. And I'm also professor of practice at Dr. D.Y. Patil University Center of Online Learning in Pune, in India. And I'm very happy to be here to tell you about our experience treating more than 30,000 patients with Ayurveda in my clinic in Germany. I will also explain you some principles about Ayurveda and also some of the scientific research on the treatments on which we focus here. This is a picture of the building where we run the clinic. We have been invited by the state government in Germany 33 years ago to start the clinic here. It's a very famous building in Germany. It used to be the Emperor's Palace, and it has 6 hot springs of healing water right under the building. We started very small with 9 staff members at the time, 1992, and we had grown to 90. But due to COVID, we had to reduce a little bit. We are now at 65. And we have a wonderful team of staff. And this is a picture of one of the hotel rooms here. This is a picture of the lobby of the hotel. And the clinic has earned more than 25 prestigious national and international awards. We have 1,200 square meter of treatment facility, our own Ayurvedic kitchen. It's a vegetarian kitchen, organic kitchen. We have a teaching kitchen. We have yoga rooms, lecture halls, many guests from all over the world, and they average stay 10 days, but some even stay 3 weeks. We have made up Ayurveda very popular in Germany. We had about 1,200 press reports, 300 favorable television reports. Uniquely, our center has reached hospital status, which is in Germany quite something. We have big support from the state and the city. And the uniqueness is that we are trained by Maharishi Vedic University for standardized, very high quality of doctors and technicians. And we have also some challenges. There is no health insurance coverage. We have to compete with 1,200 spas that use Ayurvedic treatment, but not in a medical sense like we do. It's very labor intensive. We can treat like 25 patients at a time, and we need more than 60 staff for that because all the treatments are done with 2 people. And so there are quite a few challenges. This is a picture of my teacher, Maharishi Mahesh Yogi, who inspired me to do the clinic in this place and who revived Ayurveda, which was fragmented in India and still is to some extent. He brought the elements of consciousness back into Ayurveda. And he worked with the greatest and most respected Ayurveda scholars and Vaidyas experts from India at that time to bring the lost pieces of Ayurveda together to a whole. Maharishi organized many, many conferences with the family traditions of India to bring back those therapeutic and diagnostic parts which are not taught in universities anymore. And he set a very high standard for the training of doctors, technicians, and also for the production and the safety of the Ayurvedic herbal preparations. He organized many, many conferences. And Dr. Girish Momaya and me and my colleagues, we have been organizing many Ayurveda conferences with hundreds of people. The next one will take in Pune in January, February 2025, where we expect 1,200 experts to come from all around the world. So the goals of Ayurveda is prevention. My colleague extensively talked about it. Restoration of balance, like in Chinese medicine, we don't treat diseases, but we help people to come back to balance. Cure is a very important part. Longevity, enlightenment, that means unfolding the full mental potential. That's what enlightenment means. And even the creation of a disease-free society is the goal of Ayurveda as proclaimed by the ancient rishis, the seers from India. Girish already has defined this quote, Ayurveda means the balance of the doshas, but it also means we can only be healthy when we are experience a permanent state of inner happiness. And that can only be achieved through the experience of consciousness, that field within us, which is unbounded awareness, which never gets sick. Now, the understanding of Ayurveda is there is a unified field of natural law as defined today by modern quantum field theory. In Vedic terms, it's called Sanghita, the wholeness. And from there, the 5 elements rise. Space and air give rise to the Vata dosha, fire and a little bit of water to the Pitta, and the water and the earth element to Kapha. These are kind of metabolic principles. And everybody has a specific nature with whom he is born. Now, Kapha is responsible for the cohesion, the structure, and the water systems. Pitta is responsible for metabolism, digestion, and transformation. And Vata is responsible for all movements, transformation, and communication. Vata has certain properties like being cold, light, dry, rough, subtle, moving, leading the other doshas. Pitta is hot, warm, sharp, fluid, slightly oily, light, sour, and pungent. And Kapha has the properties of heavy, cold, soft, sweet, stable, steady, slow, and sticky kind of things. And when these doshas get out of balance, then diseases start. Now, often I'm asked from the media, what is actually the difference between allopathic medicine and Ayurvedic medicine? And the difference is that, like my colleague from Chinese medicine said, when imbalances grow, they manifest into diseases. In Ayurveda, we know that there are 6 stages of the development of a disease. And modern medicine, which has great merits, I wouldn't be here today without the help of modern medicine, but modern medicine can detect diseases from the Ayurvedic perspective only when they have manifested at stage number 4 or 5. Now here you see, first the doshas, when they get out of balance, they accumulate. Then they get aggravated, then they start to disseminate, then they localize in the weakest part of the body before they manifest, and finally erupt. And when we can detect diseases in the earlier stages, they are much more easy to treat. If diseases are there from the Ayurvedic perspective in stage number 1 and 2, we just need to go to bed early, to have a proper diet, and some exercise. Maybe stage number 3 has been reached. We have to add the experience of inner silence, ideally through transcendental meditation, yoga exercises. Stage number 4, we may need some herbal preparation or some detoxification. But when stage number 5 has been reached, the Ayurvedic physician would send the patient to get a modern treatment. He may need surgery, for example. He made very strong medicine, modern medicine. But even then, the Ayurvedic approaches would still be recommended to strengthen that part of the body which is weakened, and also to some extent to take care of the side effects. Now, how do we diagnose the early stages of a disease? There are many measures like tongue diagnosis, but the most significant that Maharishi has revived in its entirety is called Nadi Vigyan, pulse diagnosis, as you can see here on the picture. And just by feeling with the pulse, how it feels in the fingertips, we can see where there is some imbalance growing into a disease. So the pulse diagnosis is something that Maharishi Vedic University is now even starting to teach in universities and colleges, Ayurveda colleges in India. because it has been lost in the university system of India. Now, when the diseases are detected, we have like 20 treatment modalities, and they can be divided into 4 areas. We have mental approaches to come back to balance, like transcendental meditation. Then we have physiological approaches, like the herbs and detoxification with panchakarma, which I'll explain. And then we have a lot of behavioral approaches, like diet, the knowledge of daily routine, and many, many more. And then we have environmental approaches, and my colleague later on will go more into detail about those. So we have even the houses in which we live have an effect on our health, and even the planets. So all this is part of Maharishi's approach to Vedic health. So now we have here the psychological approaches. There's a lot of scientific research on physiological approaches on the panchakarma, which is the main emphasis of my clinic here in Germany. The purpose of panchakarma is to purify the channels of the body, the shrotas, so that the inner intelligence can flow properly again, and to re-establish the connection between the body and the inner intelligence. This is really the source of health. The treatments have been refined by top experts over the years. They have been made available, they have been standardized, and it's consciousness-based. That means the patients, they should experience this inner peace, ideally through transcendental meditation. And then we have many, many products. To give you an idea how, now I need the help of the technician, if he is there. I have a little film that you can see. He is not here. So we skip it for now. You can come. I have the treatments. I will just show you a 1-minute movie. We have about 20 like different treatments, different kinds of massages. The ladies, you can start the movie, please. Okay. Yeah, the ladies are always treated by ladies, and the men are always treated by men in complete silence. And the therapists have learned to give these treatments in complete synchrony and harmony. And we will just see a little movie how these treatments look like. This is again a picture of our building here. Panchakarma means 5 actions of purification. This is to activate the metabolism. It's called Udvatana, a medicated herbal paste. This is Abhyanga, very soothing, relaxing treatment. And the people really experience a tremendous silence during the treatment. All the therapists practice transcendental meditation, so they have this deep silence and inner alertness. Netra is a treatment for the eyes, where the pitta dosha is being balanced through the eyes. Yeah. Pindasveda is a treatment against pain. We have specific balls with herbalized pastes. And this is Shirodhara, the continuous flow of sesame oil on the forehead. But you see, before the people get the treatments prescribed, they have a 1-hour doctor's consultation. We have 3 Western trained doctors in the clinic. They all have extensive advanced training in Ayurveda, some of them 35 years of experience. And then we have an Ayurvedic expert from India who comes from a family tradition, and they work together. And the treatment plan is very individual. What herbs are used, what treatments are used. And the patients see the doctor every day. So the treatment plan is adjusted according to the progress. So here we have a description of all the treatments, some with more pressure, some with less pressure. Pizzi chili is a treatment under flowing oil. We need about 7 liters of oil for this treatment. And this is very effective to take out the fat-soluble toxins of the body. I come to that a little bit later. We have seen when we gave the treatment, the oil in the beginning of the treatment was crystal clear, kind of yellow, the sesame oil usually we use. And after the treatment, the oil was brown or green. So we were thinking, what's going on? And I will show you in a minute a research study that explains what happened during the treatment. So just to give the idea, these are the different steps of the treatment, the intake of ghee, and then we have, the bastis, the enema to clean the intestine. We have nasya to clean the head area. So these are all the different treatments. And there's some scientific research that has been done. We would need to do much more to get it recognized in the modern medical world. But these research studies cost a lot of money. There were just smaller groups, basically. But it showed here that the well-being improved, the energy improved, the appetite improved, the strength, the sleep improved, the emotions improved, usefulness improved, and the negative values like distress, tension, anxiety, depression, anger, fatigue, and confusion, they all went down after the treatments. And the intelligence was improving after the treatment, creative intelligence, short-term memory, long-term memory. This is the study one of the studies that was done with Dr. Walschitz in the University of Freiburg. And they measured the data of about 82 people who went through the panchakarma, and we're treating with oils. So everybody would expect that the cholesterol is rising, inner fats and outer fats. And what they found is that after the panchakarma treatment, compared to the control group, the harmful cholesterol was reduced by 10.5%. It's a published study. And that shows that the risk factor for getting a heart attack was reduced by 21%. It's quite significant. Now, this is really one wonderful study. What they did here is they had about 50, 60 people who went for the panchakarma treatment. And they were measuring before and after the treatment, the environmental toxins in the blood. We have two kinds of toxins. We have water-soluble toxins that you can eliminate with exercising, with sipping hot water, and going to sauna also. And then we have the second category of toxins, fat-soluble toxins, pesticides, herbicides, and heavy metals. And those toxins are very difficult to eliminate because they have been stored within the fat tissues. They have a half duration time of 25 years. That means the body would need 25 years to get half of them away by itself. But because of the bad air, the pollution of the water and the food, these environmental toxins constantly increase. And what was found is here that the people who underwent the panchakarma for 12 days, they were measuring the blood before and after the treatment. And they sent it to a different university, Colorado State University. Didn't know what the people were doing. They were just asking for 10 pesticides and herbicides in the blood. And the control group, which just had a vegetarian diet and health education during the time, they had a reduction of 1% of those toxins, whereas the average reduction of the panchakarma group was 58%. We don't know of any other method that is capable of eliminating these toxins like panchakarma can do. Even the free radicals in the blood, which are very difficult to reduce, are reduced after panchakarma. Then it has a reduction on the biological age. People who do panchakarma, they reduce their age significantly by a couple of years. And even people who just do the meditation, they reduce their biological age, but not as much when the people also do panchakarma regularly. Now we did a study in our own clinic. Our son has made his master's thesis about the effect on reducing blood pressure. And this study was conducted in collaboration with the Middlesex University in London. And so we had the data of 105 patients, 74 ladies and 31 men, and they stayed average 10 to 14 days, panchakarma, and 87% were taking drugs to reduce high blood pressure. And it was, as you can see here before, the average was 142 to 86. And then you see it was reduced significantly during panchakarma. And the people who not only did the panchakarma treatment, but in addition transcendental meditation, it was even more reduced. And this study was conducted by so many people over so many times that the p-value is 0.008. So it's highly significant, the study. And but you see, when the people come for the treatments to our clinic, we have a very holistic program. They get extra health education. We have evening lectures for the people. When they don't have time, they can see the DVDs. We have our own teaching kitchen with cooking classes. They learn transcendental meditation if they like. We offer yoga classes. And before the people go home, they have another meeting for 45 minutes with the doctor to get recommendations on lifestyle for at home and their prescriptions. And I'm very proud to tell you that 70% of our clients today come by word of mouth. So the patients here are different than in India. The Western patients need a lot of information to be compliant. You see, we give them many recommendations on diet and lifestyle and so on. And the Western patients need a lot of explanation, so they need health education. The Indian doctors, they are used to feel the pulse and give recommendations. But for the Western patient, it's not enough. He needs to know why he should go to bed early. He needs to understand why he should not eat meals in between and many, many things. And when they are compliant, then they have much better results. So these are some of the areas of benefits. Which people do we treat here? Autonomic nervous disorders, gynecological disorders, cardiovascular disorders, digestion, metabolic disorders, joint and spinal pain, respiratory diseases, allergies. We have very great success with allergies, skin diseases, and so on. Now I'd like to shift to another area about the psychological approach through the transcendental meditation technique. TM is a very simple technique. Everybody can practice. It just takes a few days to learn. And then you practice twice a day, 20 minutes, sitting comfortably with closed eyes. And you experience a very profound state of inner rest and alertness while you are fully alert. And this has so many benefits. About 10 million people from all walks of life, from all cultures, have learned transcendental meditation. This chart already Girish has explained. So this works from the deepest levels, the unified field of all the laws of nature. And it eliminates the root cause of the imbalances. And in Ayurveda, it is defined, the word health is defined by the ancient seers as swasthya. And in Sanskrit, swasthya means to be established in the self. The self is our inner, most subtle state of being, unbounded consciousness. Now in Ayurveda, also disease is defined in Sanskrit by the word pragyaparat. And when we analyze from the Sanskrit roots what it means the mistaken intellect. The intellect makes the mistake that we identify with the outer world, and what we are inside is overshadowed. And this leads to many problems. And through transcending, we experience who we are. So this is a very effective treatment modality. In the yoga scriptures, the word yoga today is misunderstood by most people as these exercises, these postures. That's part of yoga. But the yoga word in Sanskrit means unification. And the word yoga by its founder, Maharishi, he was also called Patanjali. Yoga means yoga chitti fritti nirodha. That means when the impulses of the mind settle down and we experience the inner silence, the bliss consciousness, that is really yoga. And the brain waves become very settled, very organized. We experience the least excited state of consciousness. This is how it looks when somebody meditates. And there are many, many published studies. They have appeared, for example, in America, in the National Institute of Health, in all these different areas. Increased lifespan, risk factor for hypertension is reduced, effects on diabetes, and so on. And they were conducted in the most prestigious universities around the world. This is just an example where they conducted in America with universities. And they all have been compiled in what we call the collected papers of scientific research. And then you can look for any disease, and you will find in almost every area of disease that transcendental meditation has proven to be successful. Now, this is my favorite studies of all the studies. It was conducted by the biggest health insurance in America. It's called Blue Cross. They have 500,000 members. And they have collected the data according to age groups and so on from these 500,000 members and compared that with 1,450 meditators, TM meditators, out of their database. And they did it over 5 years. So it's a very significant study. And they found in all areas of diseases, for example, heart diseases, the costs for heart diseases went down by 87%. The costs for treating cancer, just by meditating twice a day, transcendental meditation, went down by 56%, and nervous disorders even by 94%. In average, the saving was about 50% just by closing twice a day the eyes. There are 8 similar studies conducted by other health insurances confirming the benefits. This here shows a study from the Canadian health insurance. You see when the people started to meditate, the costs went down here already in the first year by over 20%. This is a study that shows the physiological rest during transcendental meditation. The hormones change, the respiration changes, the skin response changes, all indicating very profound levels of deep rest. And this study compares, it's a meta-analysis from 146 studies, and it compares the effectiveness of TM with other meditations to reduce fear and anxiety. And you can see here in the blue bar that TM is by far more efficient to reduce fear and anxiety. This study was sponsored by the National Institute of Health, and they gave 5 million to do a study how to reduce hypertension in a natural way. And the Association of the Cardiologists in America, they selected the most difficult target group, men above 55, Afro-Americans who live in densely populated parts of big cities. And they gave them 3 choices: TM, muscle relaxation, or a combination of diet and exercise. And you can see here in the blue bar that transcendental meditation, the blue line, was far superior, even within 3 months, to reduce the high blood pressure. Therefore, the American Heart Association endorses doctors to introduce transcendental meditation. So there are many more studies. Biological age is reduced. They have taken into account about 20 different factors associated with aging: blood pressure, ability to hear, ability to see, memory. And it was shown that people meditate up to 5 years, their biological age, they were average 40, is reduced by 5%. And those who meditate for more than 5 years, their biological age was even reduced by 12%. So there are many comparisons also to mindful meditation. There are studies on the herbal products. Very important for the herbal products is to go for safety. Very big issue now. It has been found that many products coming from Asia, they're contaminated, and Maharishi Ayurveda products fulfill the highest standards of safety. And we have received certain, if I just have the last study I want to show, this is a study that was done with a few hundred patients who were going through chemotherapy, ladies with breast cancer in India. And while they were going through chemotherapy, they got one Ayurvedic preparation. And it was shown that the side effects of chemotherapy went down in 22 categories out of 23. Here in the case of vomiting by 50%. So we could save a lot of money, but even more, a lot of suffering from the people if these Ayurvedic preparations were introduced in our healthcare systems around the world. We have studies on diabetes from our clinic. I can't go through them now. The buildings in which we live have a big effect also, but my time is running out. And we have also studies done on collective health. When we have terrorism, when we have wars in the world, that means there is a lot of stress in society. And when 1% of the people meditate TM, their brainwaves become coherent, they experience inner silence and happiness, then the negativity in the environment reduces measurably. And we had here one example. We had 4,000 advanced meditators. And it's a scientific study with many universities participating. And it showed when the number of the group, which you see here in the dotted green line, goes up in Washington, D.C., then you see how the level of crime in the golden line went down. My time has run out. Very unfortunate. But you can look the studies all up. You can look on YouTube. There are many YouTubes on me also on this effect of creating peace. Very sophisticated studies that have been running over decades that show that it works. We're trying to build up big groups in India to create peace for the world. And Ayurveda has become, as a conclusion, a household word, mainly through the initiative of Maharishi Mahesh Yogi, and is recognized by the World Health Organization. In Europe, we have certain degree programs, also in Maharishi University. Our next speaker is coming from there, we'll present it. And then we have the collaboration with the Maribor University in Slovenia, where doctors can get degrees here. And we need more scientific research in the West so that Ayurveda will be accepted and be integrated as an inherent part of the healthcare systems. If somebody wants to start a clinic, I have a company, I can help people that they don't have to learn from mistakes. And here you have finally some websites if you want to take a picture from here. And then you can look up the research and about my clinic and also about the YouTubes from me about other topics. Thank you very much.